a young person implementing the GFF project, we have been able to achieve several impacts, like we have more youth-friendly services at the public health facilities. We also have more budget allocation at the sexual reproductive health sector.
I've seen there is reduce of teenage pregnancy. There is also access of modern contraceptives now, and there is reduced drug abuse and substance. And also the youth now have information on gender-based violence, and they know where to access the services.
Kenye linivutia sana ni ku give back to the community information about SRH, kwa sababu mayutu wengi sana kwa hii mtaa hawana hizo information, because parents hawako nini sana kwa pia information watoi wao, wanafia sana kwa pia hiyo information.
In terms of GFF and how young people can be involved and how they can contribute, recently there is a slogan by the young people that there is nothing about us without us, meaning we cannot be talking about young people when they are not at the table. So it's very important that we involve the young people at the table where we are discussing their issues. That is the only way that we can ensure that in the next phase of GFF that we are having their interest at heart. And we are not talking about at the level of the high level meetings. We are talking about at even the grassroots level. We are talking about involving them in the planning of what is about them. Because when we are involving them in the planning, trust you me, they know their needs and they know exactly how those needs should be met. When we were doing the assessment, we would find a lot of young people saying, I wish the services you're talking about can be offered at the local chemist, because it is easier for me to seek the services at the chemist than in the health facility. And that came in as an eye-opener that, look, we are leaving out providers that could be helping us to achieve AYSRH services and ensure that we are giving services, because we are not listening to the young people, but they know where they get the services. They know that peer-to-peer information is actually the one that informs their decisions. So we are not taking out time to ensure that we strengthen the peer-to-peer knowledge. And when we are only encouraging maybe or improving the knowledge amongst the healthcare providers, then we are not able to reach the majority of the young people. So let us involve them at the planning level. At implementation level, we need also to involve them. For example, we found that in the AYSRH youth-friendly corners, where young people are being involved in, for example, HIV counseling and testing, more of the youth came. In the villages where we had more young CHVs being involved in awareness creation, in demand creation, there was better uptake than where older people were being involved.
As a young person being in the Ramka plus N space for about 3 years now, working in Kenya being among the forefront runner countries implementing GFF, I have been able to sit as a young person among key decision makers. For instance, at Tenet, I coordinate the monthly Ramka plus N coordination group meetings, where where I can speak as a young person, contributing to key documents such as the review of the Kenya 2016 Ramka plus N investment framework. So that opportunity for young people to speak for young people has been very impactful for me.
My experience being involved in the GFF has been awesome in regards to ensuring that we engage the policy makers, and also me joining the GFF platform was a result of the study, a rapid assessment study that Organization of African Youth Kenya was doing in regards to improving the sexual reproductive health of vulnerable and marginalized groups, both in Nairobi and Kisumu.
So in Kisumu, we were working in 3 sub-counties, that is the Seme sub-county, Moroni sub-county, and Kisumu sub-county. And in these 3 sub-counties, we were looking at different levels of facility, where in Seme, we were looking at a dispensary that we were working in Oriangalwala dispensary. In Kisumu East, we were looking at health center, and we were working in Nyalunya Health Center, and in Moroni, we were working in Nyangoma Sub-County Hospital. So we're just looking at it in terms of variation on how the health services are being offered across the different levels of facilities, so that we can be able to compare and contrast on the different level of services that are being offered to the adolescent and youth within these different facilities. So within this project, we've been able to engage different stakeholders, and including also the government.
So far, we've worked with a number of youth organizations where we are trying to advocate for issues that affect adolescents and young people, especially around sexual reproductive health, and also RAMCA, that is reproductive, maternal, neonatal, child, adolescent health, plus nutrition. The journey, I can say, has been awesome, considering that the project aimed at influencing some of the policies that directly affect the young people.
I would say I found interesting is that despite probably the many gaps, barriers or challenges, is that Kenya as a country, within our policy framework, we have a responsible and a conducive policy framework to ensure people access reproductive, maternal, adolescent and child health. For me, I think that forms the basis, and that is very interesting and encouraging. What I also find encouraging is that both adolescent girls and young women have an interest in making sure they make systems work for them, and therefore that again gives us leverage to make sure accountability processes work and to limit the barriers that young women and girls face in terms of accessing reproductive, maternal, and even SRH services.
An example of 2 policies that we've been directly involved in terms of putting recommendations toward the policy, and that is the sexual reproductive health policy, which was being reviewed under Ministry of Health, and Organization of African Youth, together with Youth Coalition, involved the young people in terms of collecting their views on matters that are affecting the adolescents and young people, and we presented those views directly to the Ministry of Health. Also, the consultations were going on in different counties in Kenya, and we submitted a memo that had those issues around young people. And during our consultations, when we were developing an advocacy strategy, we also had the chance to directly send the memo to one Dr. Christine, whom we hope that she will positively influence the voices of adolescents and young people.
So the biggest impact for me in this GFF is not just there's the evidence creation bit where the assessment was done, but it also has been our ability to mobilize and galvanize the youth voice into the accountability system. The GFF, or the RAMCA plus N investment framework, is a bit complicated, maybe if you were to read it from the national or the global documents. So a lot of maybe young people within the advocacy space, within the SRH or maternal space, couldn't really understand what is THS, or transforming health systems in the country. And yet they were engaging in even budget advocacy processes for the same indicators. So us coming on board through GFF, we were able to galvanize those youth voices, sensitize them about the GFF and the grant that all the counties have, and how they can engage counties in terms of accountability, and even during budget making processes where they can actually ask for interventions that go into RAMCA plus N, because that money is specifically for those kind of interventions.
So under this, we've been able to develop a policy brief, and this policy brief has been that aimed as breaking the barriers that are affecting adolescents from accessing these services. So this policy has once been adopted by the county government of Kisumu and as one of their referral documents, and they've already coded it and given it a code. Secondly, we've also been able to engage the different facility management board. Within this different facility management board, that is the facility management board of Oriangalwala Dispensary, Nyalunya Dispensary, Nyalunya Health Center, and also Nyangoma Sub-County Hospital, so that they can be able to have a youth face within these different management committees, so that these youth can be able to champion for the youth agenda and access to these services within the different facilities. And we've seen through this lobby and advocacy, we've been able to see that a number of youths have been incorporated within the different facility management boards, and they are now championing for comprehensive sexual reproductive health for the adolescent in terms of access to information and also provision of services.
One of the things I have found most interesting while engaging throughout the GFF projects in Kenya is that there is deliberate emphasis on youth involvement starting all the way from the global level. For instance, in the 2021-2025 CSO and youth engagement strategy, there is deliberate emphasis on youth involvement. So to me, highlighting youth impact and engagement is very key, and that's the beginning of having young voices on the table.
My experience with GFF mechanism, it was very interesting. I was able to do an assessment in 2 counties in Kenya, Nairobi and Kisumu. And whereas GFF mechanism have made profound impact on especially issues to do with RAMCA associated indicators, we found in this assessment that we lack the indicators for adolescent and youth. The adolescent and youth specific indicators are somehow not very clear, with only the birth rate of adolescents and issues to do with early marriage being mentioned in the appraisal document, but not very clear on how to measure them. So you find that the services are being offered in the normal clinics together with all the other women of reproductive age without disaggregating the data to show us how the adolescents and young people are being reached by the services and information. And this becomes an issue because we know what is not measured rarely gets done well. So if we do not have the indicators for adolescents and youth at the facility level, then you find even when we are doing any kind of improvements, we are not very well informed on what we need to do specifically for the adolescents and youth. And therefore it is important for us to ensure that as we are revising the RAMCA documents, as we are revising and going on improving on GFF mechanism, we have specific indicators.
We have had opportunity to contribute at different levels of policy and decision making. Some of the memorable moments was when we were having review of the adolescent and youth reproductive health policy. We looked at why the youth-friendly services were not being accessed by young people, and we came up with ingenious ideas that could be used to improve reproductive health services. We also got to learn through the research that OAY did. It talked about the youth-friendly services all over Kisumu, and we had the picture of how these services are being consumed. So we were engaging with decision makers from a point of knowledge. The research was so powerful to us, and we were also able to participate in the budget circle processes.
Engage the adolescent, youths and young women receiving services in different facilities within Kisumu County, where the adolescents, we engage them through the focus group discussions to identify different services available in the facilities and to identify the gaps hindering them from accessing the services. We also engage the facility board of management, where we had different discussions. One was to engage youths in decision-making tables in the facilities. 2, to conduct outreach and inreach to avail information to the youths and young women on sexual reproductive services like family planning available in the facilities.
I was among the research assistants who took part in the data collection for the rapid assessment report carried out by Organization of African Youth Kenya. The research was carried out in 3 sub-counties, that is Muhoroni, Kisumu East and Seme. Through this, we were able to learn more about the views that why adolescents don't access the reproductive health services. Among the listed factors were negative attitude from the service caregivers, distance from the facilities and the fear of the unknown. We were able to do the same on the side of the service providers. They were also able to give us their views on why the adolescents don't access the services, that is the fear of the unknown. And also this also enabled me to learn more about global financing facilities and some of the indicators of RAMCA. And on the same, I was able to sensitize my fellow peers on sexual and reproductive health services and information. Through this, I can engage well with decision makers at an informed point and push for access to quality youth-friendly services and information.
So what the youth should do include investment in evidence and knowledge sharing. So you find that currently we live in a world where everything that you do has to be backed by evidence. So the youth need to work on data collection to back up the information that we have with the correct statistics, updating it on a daily basis, maybe weekly basis if possible, and also be able to share that information out, especially on the reproductive, maternal, newborn, adolescent and child health, because that is what we are invested about.
The kind of innovations that the youth can come up with and the young people can come up with would serve their generation and even generations that are older than them. And so I think in the area of technology and health, products that have to do with technology, I think the youth have been ignored long enough. And so I would say meaningful engagement, supporting youth with innovation projects, funding them to be able to test some of their ideas, to pilot some of the efforts that they are coming up with, research, helping them to understand how to participate in research and how to apply the findings of research to help their own demographic, I think is very important.
I took part in trainings on policy development and community engagement that were organized by the Organization of African Youth Kenya, advocating for access to comprehensive sexual reproductive health services and accurate information among the adolescents and youths in Kisumu County.
Tumefunzwa pia how to take care of our young ones since sisi ni teen moms, na pia vile tunaweza jichunga na tuchunge watoto wetu. Alafu pia tumefunzwa kuhusu reproductive health, of which imetusaidia sana. At least tumejua vitu kama kupanga uzazi.
We have learned how to protect ourselves in family planning, kujilid tusizae tena, ndio to focus in our life and see how better we can succeed in our lifetime.
This project, we joined hands with OAY and we were able to do a number of activities, and among these activities, one of them was basically just conducting community engagements, whereby we brought about intergenerational dialogues between the old and the young on issues around SRHR and sexual reproductive health and rights. And basically this was just to bring people to the same table and to talk about issues of sexual reproductive health and rights and see points of leverage between the two generations and how we can be able to talk comfortably about issues around sexual and reproductive health and ensure that the young ones are able to access this information and also the services for sexual reproductive health well in their communities.
OAY has been instrumental in advocacy for THS in Kisumu County, especially for sexual and reproductive health for the youths. We've had several occasions where we have organized discussions on advocacy and sensitization of the youths on matters of sexual and reproductive health and the opportunities that is offered by the THS for purposes of implementing responsive sexual and reproductive health for the youth.
We've been implementing GFF project in Kenya, looking at prioritization of adolescents and youth SRH and also their nutrition needs. And one of the things that we've realized that Kenya does not have shortage of policies, laws and also of strategies. What we've realized as a challenge is the quality of the services and responsiveness of those services. So we need to ensure that this happens by strengthening our health systems, especially capacity building the service providers at the primary healthcare level so that the services they offer are responsive to the needs of young people. And then secondly, we need to ensure that the community is engaged in a way that it helps to give feedback on the quality of the services and also support demand generation for the services that are being offered. And lastly, also looking at working with the community health volunteers and workers to be able to communicate the government priorities agendas and the THS and ensure that those who have not been reached by the services can actually be engaged. And finally, we need to relook at the management of our health facilities, especially at the PHC levels, level 1, level 2, and ensure that their governance is in line with the Kenyan requirements, looking at involving the communities in the leadership and also young people in the management committees and boards so that they bring their priorities on the table for discussion and ensure that accountability happens at the community level.
I think we have layers of a strategy that we put in place to ensure that resources that we appropriate for the county to be implemented by the executive are prudently used. One, at the assembly level, we have an implementation committee that ensures that all things that are passed in the assembly are implemented. And then two, we have the committee on health who ensures that they get quarterly reports, implementation reports from the department, and they scrutinize how they are performing in terms of budget or program implementations that they had budgeted for the year. And then lastly, we have a Public Accounts and Investment Committee. I think this committee ensures after the audit reports are out and the audit queries, they ensure that all those audit queries are answered, and if not, then the people who are culpable for the audit queries are put to task over them. So I think this multi-layered approach ensures that all the resources that we have in the county are properly used. But I don't want to say that sometimes, even with that multi-layered, we still miss to catch some of the misappropriation of resources. But we hope, I think the best that should happen in each and every county, and Kisumu in particular, is just to have staff and members, citizens of Kisumu, who know that prudent use of resources is good for all of us, so that you don't wait for anyone to police you to ensure that we have drugs in the hospital, we have mothers receiving their family planning pills, we have kids getting their vaccinations. I think if it's the responsibility of all of us, then we'll not have to be policed to ensure that this happens, because it's for the good of all of us.
Yeah, most of the hospitals provide family planning. I'm aware of that, but you find that most young mothers or most girls don't want to take or to participate because they are more afraid of those family planning because of the after. They say the repercussions are, I don't know whether it's a myth or is it true. They are afraid of taking or participating in family planning. The county, I think the county should provide in fact free maternity. It must be free maternity. You should not pay anything for maternity. And I think we should encourage our ladies, our mothers, our girls and our families to take NHIF. And if somebody holds an NHIF card, he should be treated free of charge, including maternity. And after giving birth, he should be accessible to vitamins that can help the child grow more healthy.
Generally from experience, the youth don't engage much in their own activities. So with the THS funds or with the partners present, we can bring around, we can engage the youth directly to help us in making activities, specifically supporting them. When we involve the youth in making decisions, it will help them because we do activities that they have prioritized themselves. When we do activities that they have not prioritized, they will not even attend those activities. So we should engage the youth themselves in the activities that they are supposed to do.
Organization of African Youth has been working with GFF since 2016. Since we began our work in prioritization of RAMCA in the country, we have learned that partnerships are very key in ensuring that the GFF agenda goes forward. We are therefore calling upon all our partners who are like-minded and CSOs in the country to partner with us, to collaborate with us, and to move this agenda forward.